Hello, my name is Brad Nelson, and in this presentation we're going to talk about falls. Falls can happen just about anywhere. Walking around the house, stepping outside, going up and down stairs, getting out of the shower. A fall can be detrimental to your health and cause serious side effects. Are you worried about falling? What would happen if you had a severe fall? How would this severe fall affect you and your family members? These are all important questions to consider when the possibility of falling is part of your life. Here are a few suggestions that may help you in understanding what to do or how to prevent falls. Possibly wear a wristband to help notify others that you may have a medical condition or take medications that may affect your balance. If education about possible falling is needed, include your family member or close companions to help you limit or control the chance you might fall while you are in your home or anywhere else. Vision is important, but be aware that this can change and greatly increase the odds of taking the wrong step or tripping, so it might be a good idea to get this checked out. So, your hearing is also important. See your medical provider because the loss of hearing or ear problems can cause you to be dizzy or lose your balance. Be aware of safety hazards in your home. You may love the rug in your living room, but it may be a good tripping hazard. Look at installing handrails to use if you have stairs. Talk to your family members or an electrician about improving lighting in your home. This will greatly increase your vision and help avoid tripping hazards. If assistance is needed to help you get out of bed or ambulate around the house, try making sure your person that is assisting you be trained in using a gait belt and proper lifting. This will help protect you and your assistant's back. Know your limitations and don't be afraid to call for assistance. Maybe consider a medical alert system if there is a chance you may be alone for an extended period of time. Keep your strength up by eating well and exercising. Develop a plan with loved ones in case something does happen. Know your medication side effects and avoid drinking excessive amounts of. In case something does, know and understand the signs and symptoms of osteoporosis. I'm sure you're tired of listening to me talk about all these suggestions. So let's look into home prevention and prevention of falls if you are in a long-term care facility or hospital.
Hello, my name is Angel and I am a GBC nursing student, and today we will be discussing how to prevent falls at home. So with no further ado, let's get started. A big way you can prevent falls at home is making sure that your house is free from clutter. Having unnecessary boxes, clothes, shoes, throw pillows in your walking area or stairway is very important when it comes to preventing falls. Having wires and cords running across your walkway or under rugs is a very big tripping hazard. I would recommend that you place them on baseboards, on your walls, away from the walking area. Another thing when it comes to cords, I would recommend that you disconnect them from the plug and not the cord. And I would keep plugs and electric wiring away from water. Another way to prevent falls at home is making sure that you have adequate lighting in your home. The recommended watts is above 60. Making sure that you wear your glasses and your hearing aids is very important within your home to make sure that you're not running into things, that you're not tripping over anything, that you know exactly what is going on in your surroundings. If you use accessory devices such as canes, walkers, or wheelchairs, it is very important to have them within reach, as you never know if there's an emergency and you need to reach it right away. Another way to prevent falls is getting in contact with your community. Some communities provide safety education that involves police officers, firefighters, ambulances, paramedics, and oftentimes they will give you education and give you whistles as necessary. When it comes to your neighborhood, it is very important to know where you are. If you have recently moved to a new neighborhood, it is always good to do your research and take a walk around your block to know if there's any tripping hazards, such as sidewalks that are uneven, any lighting, any lampposts that are flickering, and just to get to know your surroundings as well. Another way to prevent tripping hazards at home is in the bathroom. You can have a non-slip mat in your shower and handlebars such as near your shower or near your toilet so you can grab when necessary. It is also very important that you put your medications in the same area at all times, and that you place them in their original bottles. When taking medications at home, it is important to rise slowly and lay down if you are feeling dizzy. If you feel that you are dizzy when you lay down to sitting, I would recommend that you sit down for about 3 to 5 minutes and then proceed to get where you need to be. Another way you can prevent falls is by making sure your house is free from smoke. If you are a smoker, I would recommend that you smoke outside your house, or if you are unable to smoke outside or unable to walk that far, I would recommend that you have ashtrays near your bedside or anywhere that you like to smoke. It is important to put out candles and your cigarettes before you go to sleep, as it can potentially cause a fire and you need to get up immediately. Having a cell phone that works at your house is very important, as when you will need to call 911 for any emergencies. Another way is making sure that your windows are shut and they're locked, and your doors are locked as well before you go to bed, as it can also prevent tripping hazards if you need to get up immediately if you hear something, but it can also prevent crime. I would also recommend that you have an emergency plan for any type of an emergency. If you are more frequent to falls, have a plan or somebody you can call that will have access to you and not be in long distance if anything were to happen. I would also have a plan for a fire, break-ins, and anything necessary as that. All right, that's it for me. Thank you. Have a good day. Bye.
Hello, my name is Chloe and I am a GBC nursing student, and I'm going to be talking today about ways to prevent falls in the hospital setting and in the long-term care setting. I will be talking about ways that the healthcare providers around you will prevent falls, and ways that you can prevent falls while you're in the hospital. Some things the healthcare workers around you can do is they will conduct a fall risk assessment on you to determine how high of a fall risk you are. If you are a high fall risk, they may place a sign on your door indicating that you are a fall risk, or put a wristband on your wrist indicating that you are a fall risk. They will instruct you to use your call light if you need assistance getting out of bed, and they will show you how to work the buttons on there and how to call for assistance if you need help. They may ensure that 2 side rails are up on your bed so you have something to hold on to if you do need to get up, and they will ensure that you are wearing non-skid socks or non-slip shoes. If needed, they may implement a bed alarm on your bed, so this can alert them if you are getting out of bed and may need assistance. They may also place you in a room that is close to the nurse's station. That way, if you do need assistance, they can be there quickly to help you. They will also communicate with you about what medications you're on and if any of them cause side effects such as dizziness or weakness. That way they can assess if these medications may put you at a higher risk for falls. They will make sure your family is included in the education so they can help you prevent falls while you are there. And they will frequently assess your vital signs and mental status to ensure that everything is okay and that you will remain free of falls. They will also be sure to place you in a gown that is not too tight or too loose. If it is too loose, it can catch on something and this can increase your risk for falls. They will also help to make sure that all of your personal belongings and things that you need are within reach on your bedside table so you don't have to get up so far to grab them. Some things that you can do to prevent falls in the hospital are, if you use a walker or cane at home, be sure to bring this with you to the hospital so you can use it if you need it. Be sure to let your doctor know if any of your medications you're currently taking cause dizziness or weakness, so this will prevent a fall. If you wear eyeglasses, be sure to put them on so you can see your surroundings clearly before getting up. And if you wear a hearing aid or hearing assistive device, be sure to put that in before attempting to get up so you can be more aware of your surroundings. When getting up, it is recommended that you sit on the edge of the bed and dangle your feet or count to 10 before you stand up. If you stand up too quickly, this can cause your blood pressure to drop, which can increase your risk for falls. Let your healthcare provider or nurse know if you have any conditions, past injuries, or past surgeries that could increase your risk for falls, as it could create weakness in some of your arms and legs and put you at a higher risk for falls. The nurse or healthcare provider will also talk to you about resources for transportation needs if you need them. They will set you up with resources for getting to and from places like the grocery store or home. So if this is something you may need, contact your healthcare provider. And lastly, be sure to look at the handout we have provided for you for further information, and be sure to contact us if you have any further questions. That's all from me. So remember, be safe and call for assistance if you need to get up, and let's prevent falls together. Thank you.